All right. Now, am I visible to you?
Yeah, you are visible and audible too. Alhamdulillah.
Yeah. Okay. All right. So, how's
Very good
everything going
afternoon.
on?
Yeah, everything is going good. Alhamdulillah. How about you? How's the things at your end?
Yeah. Alhamdulillah. Everything as good as can be. So thank you for asking. So, welcome to
Yeah,
our session. And as this is our first recording, so I would like to know something about you.
sure. So, shall I introduce myself?
Yes, sir. Please.
Yeah. Hello. First of all, I would like to express my wholehearted gratitude that you gave me this opportunity to introduce myself. I am Muhammad Khaja Mainuddin. I am 35. I belong from India, but currently I am living in Qatar, the Middle East country of Gulf countries. I reside at Doha City. So, apart from this, I work here for a gaming industry where I will be handling all the icons and the staff. So, this is an informal interview. So, this is all about me. Thank you for giving me this opportunity to introduce myself. Apart from this, I also run a YouTube channel that I started just recently where I will be uploading all the conversation videos.
All right. That's a charming introduction of yours. And
Yeah,
okay, so I should also introduce myself. My name is
please.
Shabnam, and I'm connecting with you from Mumbai. And by profession, I'm a pharmacist and trader as well. I have been in this field for the 4 to 5 years. And also, I run a YouTube channel. Few days ago, I have created a channel, and as we are a English language learner, so whenever I get time, I make conversation with the co-learners and the tutor, and the same video I upload on my channel. So yeah,
Okay.
this is my brief introduction.
Yes, that was a nice introduction. Good to hear you. So,
Okay.
you by profession is a pharmacist.
Yeah, by profession, I'm a pharmacist. I did my diploma in
Oh,
pharmacy. And it's a
okay.
quite a long time. I did in, I think, 8 to 10 years ago, this diploma in pharmacy. Yeah.
Yeah, very noble profession. Alhamdulillah.
Oh, it's a
So,
hectic as well. It's
yeah,
hectic as well because lots of medicines are available, and what happened like on the name of same medicine, same constitute,
yes,
lots of generic medicines are available, synonyms are available, and we have to memorize all the things. And sometimes what
yeah,
happen when the prescription comes, so we need to give alternative of that medicine, same medicine. So
yeah,
in that case, what happened? We our brain power should be good so that we can recall all the things at a time quickly. It's a spontaneous kind
yes,
of work. And the time, if
yeah,
I talk about the timing, it's ridiculous. Like for me, it's a ridiculous because
okay,
they like we are like said that okay, you have to give time only for the 8 hours, but this is not happen. And generally, when the time comes we have to go our home at that time more prescription come and we can't do anything, we have to continue our work. It is said that work is for the 8 to 10 hours, but in reality it is
yeah,
not. We
I
have to spend
understand.
lot of time.
Yeah, you will be giving more half hour, 1 hour, or maybe two
More
hours.
sometime more 2 hours,
Yes.
yeah, exactly.
So this happens because you are in a noble profession, so you must be giving your some sort of valuable time. Okay, so it's fine, but the only thing is challenging here is this nowadays. This, as you said, there are a lot of generic medicines out there in the market. So it like it's just too impossible, or maybe some sort of difficulty to just we should remember at the fingertips the formula for the alternate medicine,
Yes,
because
exactly.
there are a lot of drugs with the same composition, is it?
Correct.
Hmm.
You're getting
So
correct.
yeah, because of the generic medicine, I guess there are the advantages of the generic medicines as well, because those are like for cheap, right?
Yeah, but this is the advantage for the public, for the patients, but not for as a pharmacist, as a shop like medical shops, because the margin after
Yeah,
coming, let's say
margin.
generic medicine, margin has got dialed down, and
Yeah,
it's not good for us. And competition, as usual, we know that there are in every field we have lots of competition. The same here. If I talk about my area, so like in every building. there are 4 to 5 medicals are available. So competition is
Yes.
huge.
Yeah, nowadays everywhere the medical competition is huge, and moreover, shops are expanding day by day, but the sales has got reducing. And apart from this, I guess as a pharmacist, I would like to ask you one thing: that what do you prefer for the general public to go for the generic medicine or for the prescribed medicine, like as per the formula prescribed by the doctor?
Okay. So, if we talk about the generic medicine, what should be like a journal people prefer? So, I have a discussion regarding this. I have done discussion with a doctor, and she said to me, like, if there is a no difference, only difference is that brand difference. Like, if we purchase any brand medicine, so whatever cost we are going to pay, this is only for the brand, not for the like composition of the particular medicine. So it's totally fine if we use generic medicine because composition is totally same, and it's good for those people who are at middle class and who don't have much money, enough money to purchase any medicine. So I'm pretty sure there is no difference. It's all about the branding and the popularity of a particular company like Cipla. It's a like famous company. Dr. Reddy, we all know about Dr. Reddy. It's a coveted. So that's why they have increased their amount of the particular medicine. Otherwise the composition same if we go for search for the same medicine in the generic. So there is no
Oh,
difference. Anyone can easily
yeah.
purchase generic medicine. If my in my family member, my father and mother, they have been a diabetic patient for the 7 to 8 years, and they always take generic medicine for the diabetes and BP. They always take.
Okay.
We never
So,
go for the branded medicine.
yeah, I mean to say that as long as the composition, the formula is remains same for the
Yeah,
brand
same,
and
same.
for the generic medicine, is it safe to take? Is it?
Yeah,
And
it's totally safe.
it's all depends on the branding, as you said, like the companies like Novartis, Cipla, Dr. Reddy's. These
Exactly,
medicines
sir.
that cost only because of their brandings.
Yes, exactly.
Because yes, of course, there is a huge competition out in the market for the medicals, and these medicine companies also well versed, reputed. They have got the versatile place in the market. So for the sake of their branding, the price will be double of the medicine to that of this generic medicine. Is it?
Exactly, sir. I would like to take your look and one another point. Actually, what happened in our area, like in Mumbai, I'm talking about the Mumbai. So, what happened whenever there is a doctor, like clinic is there, so they have a tie up with the medical store. So,
Yeah,
what they do, they take a margin from that medical store, whatever the prescription they give, and according to the prescription, they take margin. So that's why clinic, most of the doctor and the clinic, they prescribe the same medicine which is available on their tie-up medical store. So
yeah.
that's why people have to buy the same medicine. They are not going to disclose that this thing that okay, no, you can go with the generic as well because they are not going to get any kind of benefit from this. So that's why this type of activity also going on behind.
Yeah, side by side, what happens here is like, these people are tied up with the medical shops and as well as all the medical representatives are visiting every now and then to the doctors, and they will be highlighting to their brands. And
Yes, exactly.
accordingly, the doctors will also prescribe the medicine, right?
They are not going
So,
to say the patient, no, no, you don't take medicine
yeah,
equally. You can use the generic medicine. It is good for you. They like most of them because like with whom I
no,
did consultation. That was my personal like it's my family. That doctor is a kind of a family member. So that's why she
yeah,
disclosed these things to me. Otherwise, if you go to ask this question to any normal doctor, they are not going to let the cat out of the dog.
yeah, and I think is it comfortable for you to disclose here on social media, or it's better we can
It's
flip the
okay.
topic?
It's
And
totally
yeah, these
fine
are
if
the
any person.
this is known by everyone nowadays, because yes, in India we have, like, medicine is one of the highest expensive expenses. If one gets sick, so he will be paying off everything for his
Yeah, especially
treatment.
and especially we talk about the BP and diabetes. So nowadays, what happen each and every family, there are 1 or 2% available who has been suffer from this disease, and they
Yeah.
have to purchase medicine of 2000 3000 rupees per month that they have to purchase.
Yes.
They don't have any other alternative. So for them, I feel they should go with the generic, because
Yeah.
personally my parents, they are using, they have been using for that 8 years 7 years, and they don't have any kind of issue.
Yes. Yes. And I personally believe that nowadays the generic medicine and generic medical shops are emerging in India, and this for these generic medicines, even the government is supporting, right? Some shops come up with the subsidy of government as well. And the other thing is like I also personally believe that generic medicine can be beneficial. Like if suppose one can't afford much money, so he could rather go for the generic medicine if we can keep apart the branding. So again, after this, I can say one thing here. I guess this generic medicine, like. In that also we should keep in mind one thing, that for few particular medicines that we should better go with the brand, even though if it costs little
Yeah,
more.
100% we can't say like 100% each and every medicines are not available in generic.
Yeah.
Maybe in the future it will be available, but right now if you talk about, so 90%
Yeah.
medicine we can easily find out.
Yeah, because it's all depends upon the one's knowledge. You being a pharmacist, you can, figure it out that which composition is exactly matching to the branding medicine and to this of
Exactly,
this
exactly.
generic medicine. But as a common man, but as a layman, for me, I am a novice here. So I don't have any idea about the drug composition. In that case, that in some cases where the patient, according to the patient's situation and his health, we should act that where we should go for the generic medicine and where we should prefer for the branding. So the brand, like maybe it would cost us little bit higher, but the thing is that the medicine composition will be like 100% as per the prescribed medicine drug. So that would help us in our the critical situations.
Yeah, definitely.
This is
And
what
people do
this
this
is
thing.
what I yeah, this is what
I
I
agree with
believe
you.
as per my knowledge.
Yeah, yeah. Like as far as my knowledge concerned, this has happened, and most of the people, they do the same thing. Whatever they are prescribed, they go with the same brand and same medicine, because they are not going. They don't want to take any kind of risk regarding
Yeah.
their disease or anything. So
Yeah.
they like always cautious about this. But yeah, if any person they have a good knowledge about the medicine, like me, like I'm a pharmacist, so I have a knowledge, good enough knowledge. I remember last time, well, like my grandfather was there, and he needed some medicine, and we couldn't find the brand of the particular medicine, so I went with the generic medicine, and that time the composition was not available in the single medicine. So what I
Okay.
did, I combined two medicine together,
Yeah, yeah,
because
yes.
I knew the calculation.
You know
So
the
I combined
formula.
two yeah, formula and
Yeah.
composition. So I combined two medicine together, and then after that I called my family doctor, like this thing I have done, so it is good or not. So she had said, she started laughing like, from where
Yeah.
did you get this idea? First she started laughing, and then she said, okay, hi, you can go with this, it's like perfect, you can go with this easily. Then I gave that medicine to my grandfather. So this has
Yeah.
happened. It's totally all about the knowledge regarding the medicine.
Yeah.
Otherwise, it's quite difficult to go with.
This one also how I could figure it out here, because fortunately, Alhamdulillah, one of my niece was also like a pharmacist. She has done
Oh,
her pharmacy. So from her, I just got to know this. One incident happened in my life as well one time, where I couldn't find any medicine, during the late nights. Those are the early days, like that time, not this much of medicines and not 24 hour services was there. So that point of time, she being a pharmacist, this is where the knowledge comes into power action. So what she did, she formulated one medicine out of two compositions. So this is
exactly.
where what difference is there for a pharmacist and for a medical shop owner. Medical shop owner is nothing but some cases he is like a shopkeeper, like a vendor, like a merchant. But whereas
Correct.
you hold a certain degree, you know the chemical formulation. So being a pharmacist, it is better always. And in fact, I saw some other people there, like some brands like Apollo Pharmacy and some med place. There they will hire one pharmacist, particularly in their every medical shop, so that if any problem comes, like if any composition is not available there, that pharmacist would help them to figure it out for the next alternative medicine, is it?
Yeah, exactly. And few
So
people, they are a brand lover. So they are
yeah,
like, especially they go with a particular brand. They don't want to take any other brand of medicine. So
yeah,
this also
because
happen.
for everyone, health is wealth, right? So some people are very health cautious because they don't want to cost their health at any cost, is it? So cost their life at any cost. So they would prefer for, like, whatever the cost it would be, they are ready to pay for the brand,
Hmm.
whatever the medicine prescribed by the doctor. On the
Yeah,
whole, I could
exactly.
say here one thing is that these days, like every other person, they are facing BP and blood sugar, and as well as this, what we call this one, sugar. It has become
Diabetes
very,
and that.
very common
Hmm.
now. So
Heart
every
patients
second
is also
person,
are there.
yeah,
Heart patients.
yeah, but particularly these two things like BP and sugar, these people, they need every month medication. Like they would be
Yeah, till their
required
life
to,
end.
yeah, because this sugar, I guess, this is the silent killer. Once it is adapted to the human body, so it will never going to lose. It may reduce and increase, but the thing is that the medication is must for them for lifetime. So in this case, what happens then? We must be taking medicines alternatively, like as per the prescription. So here in this case, I guess we can opt for this generic medicines. There we could save some money instead of
Yeah,
going with the
exactly.
brands.
Hmm. That's why I'm like telling everything. Like we can go with the generic medicine. But it's depending. Few people, they have enough money, they can easily buy anything like any brand medicine. They can go with this. But apart from this, if we talk about the person like who are middle class and they don't have enough money, so they obviously they can go for the generic medicine.
Yeah. As a pharmacist, you told, then in fact the people can go for the generic medicine as well, but it should be better that they must aware of the drug what they are
Yeah,
purchasing.
exactly. They must
Yeah.
aware about the composition.
Yeah, here this point should be noted because there would be some people out on the community, they will be watching these videos as well. So we must not mislead to anyone.
Yeah.
At
Thank you.
last,
Like at least
yeah,
you clarify that particular concept. You told that
yes,
okay, at least knowledge should be concerned there. Like you should be a particular fixed knowledge about that composition and everything.
yeah, because there will be pharmacists in every branding pharmaceuticals like Apollo Pharmacy or Medplace or some other brands. There will be a pharmacist. They better should go and ask to them, take their advice, then they can decide upon the
Yes,
drug.
exactly, exactly. We're on the same
Yeah,
page.
yeah. Above
All
all, I
right.
could say only one thing to you, that you are giving your good contribution to the society. So I really admire your profession. You are holding such a noble profession.
Yeah, sir. But nowadays, I don't have any job regarding pharma. I used to do a job in a medical store as a pharmacist, but after
Okay.
Corona, I quit that job because the timing and my timing and the work timing was mismatched. So I couldn't continue that job. But yeah, my friends are there. So on the daily basis, not daily basis, but the regular basis, frequently we discuss about the medicine if anything happens. So most of the time we are aware of all these things.
Yeah. Yeah, yeah. Yes, because actually you will be indulging in the same field, even though if you are a little bit now off from your responsibilities, but still you will be just following up the present changes in the medicines, the compositions. Yes. And apart
Yes,
from
exactly.
this, like, would you like to ask me anything? Do you have any question?
Yeah, sir. I have a question for you, but I feel like our time, we are running out of time. Definitely, I will ask a question, whatever question is in my mind, I will ask to you. But right now, for this session, I feel we are running short of the time. It's only the
Okay.
20 minutes, and if it goes lengthy, it's quite difficult for the viewers to watch that video.
Okay, then no issues. Then we will be discussing in the next session.
All right.
So yeah, it was nice talking to you. And by the
Really, it was
way,
nice talking.
yeah, by the way, you didn't introduce yourself. We just jumped over into the topic.
Oh, no, I introduced myself. You forgot, I feel.
Oh,
I
you
introduced.
introduced.
At the beginning of the conversation, I introduced. That's why we
Okay.
started delve into this conversation regarding the pharmacist. Then you got to know, okay, I'm a
Oh, then
pharmacist
I got to
after the
know that you are
introduction.
a
Yes, yes.
pharmacist. Yes, yes, of course. Yes, I forgot. I just lost the train of my thoughts.
Exactly, sir. Okay, all
Yeah,
right. Really, it was a lovely conversation with you, and I enjoyed this conversation.
I too. Same here. God bless you. And hopefully, we will have another session soon enough. So then we will be discussing some other topic, inshallah.
Definitely, sir. Surely.
Yeah. It was nice
Surely.
talking to you. Have a nice day. Bye bye. Happy Ramadan.
Okay, sir. Bye.
Bye.